Good morning, everyone. Today we are conducting a deep dive into Ophelia, a healthcare innovator that is fundamentally redefining the treatment landscape for opioid use disorder, that is called as OUD. We will utilize the business model Canvas to examine how their telemedicine first approach is successfully transforming recovery across the United States by removing the traditional barriers of geography and social stigma. Good morning. Ophelia's mission is simple yet profound: to make high-quality, evidence-based OUD treatment universally accessible via telemedicine. Their vision is to foster a world where everyone has the chance to thrive in recovery. These goals are anchored by four core values: integrity, compassion, excellence, and collaboration. Strategic intent: the mission focuses on evidence-based care, specifically medication-assisted treatment, which is the clinical gold standard for OUD. Value alignment: these core values aren't just slogans, they guide clinical interactions and business decisions, ensuring that patient trust remains the top priority in a sensitive field. Scaling impact in healthcare requires a robust network. Ophelia's key partners include healthcare providers like clinics and hospitals to ensure continuity of care. They also work with pharmaceutical companies to secure a steady supply of medications like buprenorphine, and insurance providers to make treatment affordable by securing coverage through major health plans. In ecosystem strategy, it involves by partnering with insurance carriers. Ophelia removes the primary barrier for low-income patients and costs. Under operational support, technology providers are also crucial, ensuring the platform remains HIPAA compliant and reliable at a national scale. What does Ophelia do to deliver on its promise? Their operations are divided into four main pillars: developing their secure telemedicine platform, managing complex med protocol under licensed supervision, providing virtual counseling and peer coaching, and navigating the rigorous multi-state regulatory environment. In clinical management, beyond just technology, they manage the clinical life cycle of the patient from initial prescription to long-term behavioral support. In regulatory regard, a significant activity is maintaining compliance with varying state laws regarding controlled substances, which acts as barrier to entry for smaller competitors. The foundation of Ophelia's success lies in its specialized resources. This includes their proprietary telehealth platform designed specifically for addiction care, a network of licensed medical professionals trained in trauma-informed treatment, and advanced data analytics to personalize care plans. In human capital, their network of doctors and nurses is specialized in addiction medicine, which is a scarce resource in the broader medical field. Data advantage: in using artificial intelligence and analytics allows Ophelia to predict patient outcomes and refine their clinical protocols continuously. Ophelia creates value for two groups. For patients, it provides discreet, convenient treatment from home, which significantly reduces the stigma of traditional rehabilitation. For the healthcare system, it offers a cost-effective way to deliver care at scale, reducing the heavy burden on emergency rooms and hospitals. In patient's job to be done, patients need a way to recover without interrupting their lives or facing social judgment. Under economic value, by treating patients at home, Ophelia helps health systems lower per patient costs and reach underserved rural populations. In OUD treatment, the relationship is the product. Ophelia focuses on fostering long-term recovery through a patient-centric, non-judgmental approach. They maintain trust through ongoing virtual check-ins, data-driven personalization, and the highest standards of data privacy. In retention, recovery is an ongoing journey. Ophelia's model is built for high retention, using empathy and consistency to keep patients engaged in their treatment over months or years. The trust in a digital environment, maintaining clinical excellence and secure data handling is the primary way they build brand equity. To reach patients at the moment they are ready for help, Ophelia uses a multi-channel strategy. This includes digital discovery, that is online marketing, referrals from traditional medical providers, and partnerships with employers to provide care through workplace wellness programs. In trust-based referrals, while digital ads are useful, institutional referrals from hospitals and physicians provide the credibility needed for such a sensitive healthcare category. In accessibility, a diversified channel strategy ensures they meet patients exactly where they are searching for help. Who is the Ophelia patient? They primarily serve individuals in treatment deserts, rural areas where clinics are non-existent. They also serve privacy-seeking professionals who need the discretion of virtual care and anyone specifically looking for evidence-based math options like buprenorphine. In underserved markets, geographical isolation is a major reason for treatment failure. Ophelia effectively eliminates this barrier. In specific clinical need, many patients are looking specifically for math but find that local clinics only offer behavioral-only approaches. Finally, we look at the financials. Peleo's revenue is primarily driven by insurance reimbursements, supplemented by direct patients payments and B2B contracts. Their major costs include technology development, salaries for clinical staff, marketing for patient acquisition, and the legal fees associated with multi-state compliance. In sustainability, by focusing on insurance reimbursements as their primary source, they ensure the business can scale to millions of patients while remaining affordable. In competitive mode, the high cost of clinical staff and regulatory compliance creates a durable moat that protects Ophelia from new lower quality entrants in the markets.